All right, welcome everyone to the Next Gen Tips and Tricks Office Services. So Office Services was formerly named Standing Orders, which are placed in clinical using the nurse procedure form, which is that um, long sheet that has the different orders. So those include IFOBT, hemoglobin, UA dips, blood sugars, basically any point of care services here at the clinic, and immunizations as well. These are done via paper orders and completed in clinic, while the results themselves are charted electronically. So all office services will be circled or checked off on the paper, and a patient's medical sticker and room number should be then added to the paper sheet before the scribe slash physician clips the paper order to the nursing station, or depending what site you are, the location where those will be placed. Then the MA or registered nurse will then complete the order and input any results electronically in NextGen. So test procedures is ordered by the provider slash resident using the nurse procedure form and completed by the MA. Make sure you just check them off and then get a signature um, from your attending if that they're agreeing with the plan. So there you place a sticker and then the room number there and then signature if needed. Officer services can be found under any panel tab, and it's under these blue hyperlinks. So usually it is found on the left corner here, and it's now called Office Services. So once the test procedure has been completed, the MA will enter the results there, and then you can view the results by clicking on the Office Services hyperlink. You can search by clicking the search radio button here, or you could do right here where it says nurse standing orders. That's a different way to search. So once you click here, you should get a pick list and you can choose different office services. Usually the nurse standing orders should have like all the services on the procedure form. And then once you're there, you can highlight the desired order and double click the procedure to add it to today's date. So you highlight it, this diagnosis should be automatic. Then you fill out the interpretation. So for example, if it was blood sugar, you would do see detail and then type in here under detail the number, and then if, for example, they're fasting or non-fasting, depending on what details the patient gives. And then next, you just click place order, and then it should run and submit it to the super bill and get triggered. And then once, so you can know that it's completed, you should make sure to look here under today's orders, and it should say completed, and then blood sugar, and depending on the results, if it's low, it's high, or if there's a number in there as well. And then to close this, you just click OK, and it should close down the window. Viewing order status and results. So the test order along with status should be viewed under the today's order column box. So here it is. You can see that it was completed and there was a low blood sugar result. Verifying and submitting to Superbill. This should be automatic. Once you're ordering it, it should be automatic. And once you hit place order, it should run it. A little dialog box should show up. But if you want to verify that everything went through, you can verify it by clicking on the procedures box, which is the Medicate with the syringe. By clicking there, the procedures template opens up, and then you can view, for example, here it says glucose by FDA device, so we could see that it was billed. Making edits to results. To make edits to results, highlight the order selected underneath today's order, and then click on the edit button. Now you can edit the interpretations and results details. Once you've finished making your edits, you can save and close. So for example, you can edit these and then save and close it. Once you're finished placing your order, the standing order you ordered will now appear under checkout. So if you go to checkout, you should see a number depending on how many office services were performed that day. And then if you click on it, it should show the ones that you ordered and completed. Any questions?
The only question is, are the residents being trained on this properly?
Yes, they should be trained, and we do assist them when they're ordering office procedures, especially when they're coming through the clinic. We assist them with that and show them how to fill it out and where to place it. Especially here at Sims, there's the one next to the door on the second charting room, and then the pink divider rack where the other ones are placed as well.
Okay.
Mhm.
That's the only question I have.
Okay, no worries. All right, let me stop the recording.